Good afternoon, everyone, and welcome to this much anticipated hour of learning with our esteemed scholar, Rabbi Elliot Dorff. I'm Elaine Amir, president of the Haberman Institute for Jewish Studies Board of Directors. I'm thrilled to welcome you today to our first online Haberman Distinguished Scholar Series lecture. For the benefit of those who are new to the Haberman Institute or may not be sure, the mission of our organization is to provide high-quality, in-depth encounters with Jewish thought, history, and culture, as today's program will surely do. Beyond this lecture, the Haberman Institute is offering additional summer programming for the first time. We have several ongoing classes, 2 seminar series, as well as cultural events. We invite you to visit our website, habermaninstitute.org, and join us on Facebook to be in the know as we announce new offerings. I want to express our special thanks to Kol Shalom for co-sponsoring this lecture. At some future date, I hope that we'll all be seated together for a lecture in their beautiful sanctuary in Rockville. Over the next 45 minutes or so, Rabbi Dorff will speak, followed by a question and answer period moderated by our Executive Director, Matthew Silverman. If you have questions during the program, please enter them in the Q&A section at the bottom of your screen. Additionally, please bear with us if we hit any technical glitches. Rest assured, if the tech does not hold up as planned, we're recording this lecture and we'll share it with you as quickly as we can. Today, Rabbi Dorff will focus on some of the physical and mental health issues raised by the COVID-19 pandemic, exploring the topics through a Jewish lens. Rabbi Elliot N. Dorff is an expert in the philosophy of conservative Judaism, bioethics, and is acknowledged within the conservative movement as an expert decisor of Jewish law. He was ordained as a rabbi from the Jewish Theological Seminary of America in 1970, and he earned a PhD in philosophy from Columbia University in 1971. He's been awarded 4 honorary doctoral degrees from JTS, Gratz College, Hebrew Union College, and American Jewish University, and he was awarded a Lifetime Achievement Award by the Journal of Law and Religion. Rabbi Dorff is the chairman of the Rabbinical Assembly's Committee on Jewish Law and Standards, and he has written many responsa on various aspects of Jewish law and philosophy. Rabbi Dorff is rector and distinguished professor of Jewish theology at the American University in Los Angeles, and he's currently a visiting professor of law at UCLA School of Law. Rabbi Dorff is an author and a bioethicist. I would love to tell you about all the books and articles he has authored, but by now I believe you would prefer to hear directly from him. And so I turn the program over to Rabbi Dorff, live from Los Angeles. Rabbi Dorff, the screen is yours.
Thank you, Elaine. It's great to be here with, with all of you. As you can hear, I've got a little bit of a frog in my throat today, but hopefully this will all be fine. The pandemic that we are now experiencing raises all kinds of questions, both about our physical health and our mental health. And so I want to deal with those. First, we'll talk about the physical side, and then we'll talk about the mental side. Physically, of course, you know that the Jewish tradition believes that we need to take care of our own bodies. This is more than what we get in the American side of our identity, where in the American side of our identity, your body belongs to you, and therefore, as long as you do not harm somebody else, you may do with your body whatever you want. So that means, for example, if I wanted, now we're just into this now and you're going to hear my Achilles heel, if I wanted to eat a half a gallon of ice cream every night of the week, and if we're going to do it, it might as well be mint chocolate chip or Cherry Garcia. That stuff is so good. In the American side of of my identity. There's no, I would be stupid to do it because I'll gain 500 pounds in no time, and that will lead to all kinds of very bad pragmatic effects. But there's no law in the country that would prevent me from doing that. On the other hand, in the Jewish understanding of things, my body belongs to God, and I have a fiduciary responsibility to take care of my body, and therefore I am not allowed to do something which I know will undermine its health. Maimonides, actually, whom you may remember, was not only a rabbi and a philosopher, but also a physician, says that if you take care of your body so that you will be able to have children who will do your work for you, good luck, that is the wrong reason to take care of your body. The reason why you're supposed to take care of your body is so that it will be in a condition to know God and to do mitzvot, which obviously is a very different way of understanding of the reasons why we need to take care of ourselves. That, of course, means that during this pandemic, we need to get exercise, whether that's something you do in your house or taking a walk or whatever it is. It means that you have to preserve notions of proper diet. If we're around our house all day long, chances are we might eat much more than we would normally eat, and maybe junk foods along with that. We've got to make sure that we don't do that. And by the way, I've read some articles that alcohol use is way up now during the pandemic. There again, the Jewish tradition permits you to drink alcohol, but in moderation. So we have to take care of ourselves in those kinds of ways. It leads to also much more graphic questions in terms of how we deal with triage. Triage is a word that comes from the military context, where the question was, you have a number of people that have been wounded on the battlefield, and the question is, whom do you save? And the basic rule in the military context is that you save whichever ones are most likely to be able to be restored to health and then rejoin the battle. In the medical context, now, it has led to a whole variety of different understandings of how we should allocate ventilators, for example. I'm on the ethics committee at UCLA Medical Center. I've been on it for about 30 years, and we've had something like 10 hours of meetings when the pandemic first hit, as to trying to articulate a policy for triage. And there is no national policy for it, and most states don't have it either. And so what this has led to is a lot of conversation about who should get what. Ultimately, I wrote a tshuva, rabbinic ruling, for the Committee on Law and Standards, and so did Rabbi Daniel Nevins, a colleague of mine. We began very far apart, and then through a wonderful chavruta cross-country, he lives in New York, I live in Los Angeles, we ultimately came to the same conclusions, but using very different parts of the Jewish tradition. So in order to give you a sense of how that works, let me step back and talk a little bit about how the Jewish tradition understands end-of-life care to begin with. The murder, which obviously is prohibited by the 6th of the 10 commandments, is the taking of a person's life with malice aforethought, right? You intend to harm the person, and clearly against that person's will. Active euthanasia is taking a person's life in accordance with that person's will. this comes, probably the most famous cases are ones where you have couples who have been married for decades, and now one of them is in a lot of pain and wants to die, and asks his or her spouse, please help me die. And then you get cases like this in which the person gives an overdose of morphine, uses a gun, whatever, right? And it's interesting that in the American court system, the courts have been all over the map as to how to deal with that kind of situation, ranging from convicted of first-degree murder to dismissed, case dismissed, and all kinds of things in between. That's active euthanasia. Then you get aid in dying or assisted suicide. This is where where somebody is helping somebody die, but unlike the active euthanasia that I was just talking about, it's within a jurisdiction that allows for it. There are 8 states in the United States right now, and Canada, and several European countries that allow people to have aid in dying. And the laws vary a lot. So in California, for example, the person who wants this has to ask for it orally once in front of to his or her doctor. Then 2 weeks later, has to ask for it again, and this time with orally and also in writing with witnesses. And then 2 physicians have to agree that this is appropriate medically. In other words, that there's nothing medically that can be done to resolve the person's pain in a way that would lead the person not to want to die. And then the person in California, the person has to be able to administer the overdose of morphine or whatever the method is going to be used to administer it by him or herself. So it's a very demanding law. As a matter of fact, when it came into effect in July of 2016, people who really were interested in this complained that it was much too narrow, much too limited. In Canada, Canada allows for physician-assisted suicide. So in Canada, you are allowed to have somebody else, namely your physician, administer the lethal dosage. That's obviously much more accepting of this process. And therefore, and by the way, the Canadian law began about 2 weeks before, the California law that began the middle of June of 2016. And there have been many more cases in Canada of people who have used this than in California for reasons that should be now obvious to you, namely that if your doctor can do it, then you're much more likely to be able to use this law than if you have to do it and you're toward the end of life. Most states, however, do not allow this and see this as simply a form of active euthanasia and therefore prohibited. And then what happens to the person who does it depends upon the jurisdiction. And then there is passive euthanasia. Passive euthanasia means that you either withhold or withdraw life support systems. In the Orthodox world, many of the Orthodox, not all, but many of the Orthodox follow the position of Rabbi Moshe Tendler, who says that you may withhold interventions, medical interventions, but you may not withdraw them. So if the doctors have intubated you, that is, put tubes in your body in order to deliver medications or artificial nutrition and hydration, Once they do that, according to Rabbi Tendler, they may not remove it. I personally don't think that that makes much sense, because for any other medical intervention in your life, if a doctor tried it and it was not working to accomplish the goals for which you had for it, you would want the doctor to remove it, because every intervention comes with side effects, and most of those side effects are not good. So in the rabbinic ruling that I wrote for the Committee on Jewish Law and Standards, and also in a parallel ruling that Rabbi Avram Reisner wrote, this goes back to 1990, we both say that you may both withhold or withdraw machines and medications from somebody for whom they are not working to restore that person to health. He and I disagree, however, and this is within the conservative movement, he and I disagree about the status of artificial nutrition and hydration. Let me explain what that means. When a person can no longer eat by themselves, then the doctors will first try the least invasive form of delivering nutrients in liquids. It's called a nasogastric tube, an NG tube. It goes through your nose and down your throat. The problem with it is that you have, even if you're comatose, your upper brain is not working, you have a coughing mechanism in your throat. And that, and so people who have the NG tube very often try to pull it out, even if they're comatose. And so therefore, people who have an NG tube often have to have their hands tied to the bed so they don't pull out the NG tube. When that no longer is working, then they will try intravenous food feeding. That is, injecting artificial nutrition. It's artificial because it's not the kind of food that you normally have, right? It's coming through tubes, and it's not, it doesn't have taste or texture, any of the things that you normally associate with food. So they will try to inject that into your veins directly. The problem is that your veins are not really intended for that kind of intervention. And your veins will first very often leak when this happens, and so you'll get blotches on the person's skin. And then at that certain point, the vein will simply collapse, because the way that we were intended to get nutrition and liquids is by putting them through our mouth into our mouth and down our throat, into our intestines and stomach. And they're processed there, and then that kind of processed food goes through our veins. But to inject that directly into the veins is not what they're used to. So they'll probably try first in the arms. When those veins collapse, they'll try the legs, then later maybe the shoulder. At some point, that will no longer be possible either. And so then third, they'll do literally surgery into your intestine. But that's an open wound, which can get infected, but it does deliver the nutrients and liquids that you need to have. Where Rabbi Reisner and I disagree is that he sees that as the equivalent of food and liquids, which it is. I mean, that's the intention of it. And of course, we all need food and liquids. And therefore, he says that we may not withhold that, and we may not withdraw that. Other medications and machines, we may withhold or withdraw, he says, but not artificial nutrition and hydration. I see artificial nutrition and hydration as the equivalent of medicine for the reasons I mentioned earlier, namely that it's not like food in the sense that it doesn't come through your mouth. It doesn't have the usual characteristics of food, like taste and texture and temperature. And so consequently, for me, artificial nutrition hydration is like medicine, which may be withheld or withdrawn. So in the Terry Schiavo case, for example, that was a woman who was comatose. And for 14 years, because of debates in the courts at the time, for 14 years, she was sustained by artificial nutrition and hydration until ultimately her husband got legal permission to withdraw it. Rabbi Reisner would say that in that case, it should not have been withdrawn even after 14 years. And I would say that within at least after a year, it should have been withdrawn because people come out of a coma if the coma was a result of something external, like a car accident. People come out of a coma usually within about 3 or 4 months. If it was internal, something like a brain bleed or something on that order, then it may be as much as a year before a person comes out of the coma. So fine, I would have said that she should be on this artificial nutrition hydration for a year, but then it should have been withdrawn because it was not in her best interest. I mean, she was not regaining consciousness, and so whose benefit were we serving in maintaining it for that long? So that's what happens normally. But in terms of triage, the presumption of triage is that we don't have enough medical material or personnel to treat everybody who needs it. And that, unfortunately, has been the case during this pandemic, especially in New York, but also in many other places in the world. You've seen that in Italy, you've seen that in China, and you see that to a certain extent in other places in America. And now, by the way, in South America, in Brazil, in Bolivia, in Mexico, where, and we don't know whether the virus will peak again, right? In other words, we'll come back for a second round. So the question is, if you don't have enough ventilators or masks for everybody, then who gets them? And as I said to you earlier, there have been a number of different thoughts about the matter. Some would say, on a very utilitarian basis, what you need to do is preserve life years. So, in other words, you preserve the person who's going to live the longest if they get treatment now. So that would obviously prefer young people over older people. I think I'm 76, almost 77, so there may be a conflict of interest here. But my point here is that I think that from a Jewish perspective, that simply doesn't wash. Because the Jewish principle is pikuach nefesh, saving people's lives. And we need to save as many people's lives as possible. So what does that mean? That means for me, you want to treat those people who are likely to be able to make it to hospital discharge. And then, of course, what happens afterward depends upon the person's previous health condition. So some people will live for many years, some will live fewer years, some will live with certain kinds of disabilities, and others will not. But for me, regardless of age, disability, ability to pay, certainly race, gender, any of those factors, regardless of any of them, what the people that should be treated are the ones that are able to be treated and get to the point where they are medically appropriate for hospital discharge. So what happens? So that would mean if you have somebody on a ventilator who's not going to make it to hospital discharge, then you may and probably should remove that person from the ventilator and give that person what's called hospice care or palliative care. In other words, try to relieve pain as much as possible, but use the scarce resources for somebody who is likely to make it to hospital discharge. What happens if you have several such people, all of whom need the ventilator, and there's only one ventilator? What do you do with that? Rabbi Daniel Nevins would say, first come, first serve. I have a problem with that because we have major disparities in our country with regard to access to healthcare. So the person who is likely to be first is largely going to be, in our country, the person who is wealthier and who has more resources to get medical care. We're not going to resolve that question about access to healthcare in the triage situation alone, but I at least don't want to exacerbate it. So I would say that if there are 3 or 4 people who need the ventilator, and there is only one ventilator, and they're all more or less in the same medical condition, you should use a lottery. If it's only 2 people, flip a coin. If it's 3 or 4, put their names on slips of paper, put them in a hat, and pick out one. And that's the person who gets the ventilator. The reason for this from a Jewish perspective is that, first of all, each of us is created in the image of God, and therefore, regardless, again, of gender, of age, of skin color, of wealth, all of that, of ability or disability, each of us is created in the image of God, and therefore each of us deserves to be saved if we can be. So that kind of radical equality that our tradition teaches us is what needs to be the underlying principle in regard to triage. The only, again, exception to that is if it's simply not working and not likely to work. Then that person may be withdrawn or simply never given the scarce resource, and then it's given instead to somebody else who may in fact make it to hospital discharge. There are other issues like this that occur, especially in nursing homes, where, as you know, a large percentage of the people who have died from COVID-19 have been people who are in nursing homes. Some of that is a function of their age. I'm also on the ethics committee of the Jewish homes in Los Angeles, where the median age is 93. So, I mean, part of the reason why nursing homes have seen the largest percentage of people who are dying is simply because you're dealing with people who are very old and often who have other kinds of medical conditions. But part of it also is that they live within close quarters. In most cases, they have a roommate, and often they eat together. So in a shared dining room. So it's in some ways it's not surprising that you have this. There is, of course, also a whole range of quality in nursing homes, and that range of quality will clearly affect also the degree to which the nursing home is able to prevent prevent people from being infected. That applies to how often things are washed and sanitized, how often people are walked and toileted. In other words, what is the general medical condition of the people in the nursing home, and how is that supported? All of those kinds of things will be factors in terms of how this pandemic affects people in nursing homes. There's the exact same thing, of course, is true on the other end of the spectrum from a point of view of age. What do you do with children in classrooms, or for that matter, with college students, right? Where, as you've seen, most schools and universities have shut down during this pandemic, and the real question is, will they be able to reopen? And the answer to that question is different across the board, right? There are some universities that have already announced that they will simply not open in the fall in person, or at least for the first month or two. And some have said that they will open. The University of Arizona, for example, I think 60,000 some students and the president of it is a physician. The University of Arizona has already announced that it will open, but it will have all kinds of measures to try to make sure that sick people are not in the classrooms, and that people are distanced to some extent at least, and that they will wear masks. Tulane has also said it's going to open. Harvard and Columbia and have said that they're not going to open, at least not at the beginning of the fall semester. So we're beginning to see those kinds of issues. And that then leads me to two other parts of this pandemic that need to be addressed, namely the economic piece and the psychological piece. And if you want to save somebody's life, you have to look not only at the person's health care, but also at that person's ability to have food, shelter, and the like, right? Because you can die of starvation just as much as you can die of COVID-19. So the question becomes, even from a physical point of view, let alone from an economic point of view, how do we balance the need for having a working economy in our society with the need to stop the spread of the pandemic? That's not an easy balance to strike. And let me say that there are, unfortunately, this has been politicized in our country, and it should not be. It should be a balance that is very carefully weighed, and that may well be different in certain parts of our country in comparison to other parts of our country, because that goes to questions of living conditions. If you live in Manhattan and people are in very close quarters, multiple people in apartment buildings, that will probably take much longer to open up than if you live in some rural area of our country, where there may not have been any cases at all of COVID-19. And if there have been cases, they've been very easily treated. So in rural areas, we may be able to open up much more quickly. And then you have places in between, like Los Angeles, which in California is the place where we have the highest number of cases, but it's about the 10th now, even though Los Angeles and New York City have about the same population. Los Angeles has had about a 10th of the cases that New York has had, and about a 10th of the deaths from COVID-19 that New York has had. So as we open, we have to be aware of these differences. And we have to, and that leads, of course, to other kinds of questions. What about people on the front lines? The doctors, the nurses, the people, the custodians in hospitals, the people who provide, who stock the shelves in supermarkets, the people who drive the trucks to deliver the food, right? What about all of those people who are providing for us what we need during this pandemic, even if we are sheltered at home? How do we help to prevent them from becoming infected? And what do we do when they are infected? Well, first of all, do they deserve more money than they would normally get for taking on these risks? Should there be procedures whereby their risk is limited? We've had this conversation, about people who drive trucks for Amazon, and you've seen some. Amazon has a number of different commercials now, trying to indicate that they've done a lot of work to make sure that their people are not infected, the people who pack the boxes, the people who deliver them. But yet there have been a number of Amazon employees who have very publicly said that it's not doing enough. I'm not here to judge that situation. All I'm trying to say is that that kind of balancing act is exactly what we're going to be needing to do, both now and for at least the next 6 months. And we need to be aware of the fact that intelligent, morally sensitive, and informed people can differ on that issue. And the last thing it should become is a politicized issue. That decision should be based on the science of what the pandemic is doing in a particular area and how best to strike that balance in that area. Now, let me get to the psychological issues. I'm going to step back for a moment, and you'll understand why in just a moment. In the Western philosophical tradition, starting with Plato, there's a sharp distinction between mind and body. The body is the animal in you, the mind is the distinctly human in you. And throughout Western philosophy, one of the issues is the mind-body problem. That is, if the mind and the body are so separate, how are they connected? Descartes in the 17th century thought they were connected in the pineal gland. It's a gland in your head. And that was the magical place. Now there are even people who are using MRI machines to try to figure out when is it that you make a decision for vanilla chocolate strawberry, something like that. By the way, the answer to that is mint chocolate chip. Anyway, the question really is, given the fact that the Western tradition begins with a very sharp dichotomy between mind and body, how are they all connected? And similarly, by the way, in Christianity, there it's the mind and the soul. The body and the soul. The body, again, is the animal in you, the soul, the divine. So in the Catholic tradition, for example, the ideal person is the one who suppresses the body as much as possible in order to cultivate the soul. That's the priest, the nun, the monk. In the Jewish tradition goes in a very different direction. And this begins with a story in the Talmud. This is Sanhedrin, page 90, if you want to look it up, where a man has an orchard, and he leaves it in the control of a blind man and a lame man. And he says to them, don't eat any of the fruit of the orchard. As soon as he leaves, the blind man says to the lame man, this is easy. I'll put you on my shoulders. You'll show me where to go. We'll eat of the fruit of the orchard. He'll never figure out how we did that. So that's what they do. The owner comes back sometime later and sees that some of the fruit of the orchard is missing. And he says to them, I thought I told you not to eat of any of the fruit of the orchard. The blind man says, I could not possibly have done that because I can't see where it is. The lame man says, I couldn't possibly have done that because I can see where it is, but I can't get there. So the owner takes the lame man, puts him on the shoulders of the blind man and says, this is how you were created, and this is how you will be judged. Similarly, the Talmud says, the body says, I can't lead a person to sin because without the neshama, the life breath within me, I'm like an inert stone. And just as a stone cannot sin, the body cannot lead a person to sin. The neshama, the life breath says, I can't be responsible for a person's sins because without the body, I'm like an ethereal bird flying in the air, which can't do anything. I'm like the wind, and I can't do anything. So God takes the neshama, throws it, that's literally the Talmud's word, ramin, he throws it into the body and says, this is how you were created, and this is how you will be judged. It's a simple story, but it flies in the face of all Western and Christian thought. Because what it's saying is that the mind, the emotions, the will, and the body all are part and parcel of us, and they all affect each other. So the way you feel about yourself, the way you think about yourself, what you decide to do while you're quarantined, very much affect your body. And how you treat your body will very much affect how you feel about yourself, how you think about yourself, and what you decide to do during this pandemic. Furthermore, the Jewish tradition is very keenly aware of the fact that we are not living in isolated islands, right? Don't separate yourself from the community, the Talmud, the Mishnah says, right? And already Genesis chapter 2, it is not good for a person to live alone. So the tradition, now I'm going to quote you actually another ancient Jewish source. People who need people are the luckiest people in the world. Obviously not an ancient source. And Barbara Streisand is only a few years older than I am. So maybe I'm ancient. That's possible too. But in any case, the Jewish tradition is keenly aware of the fact that we have very deep social needs. Yes, sometimes we need to be alone. But we also very, very much need to be in contact with other people. And one of the clear examples of that is the fact that in a prison environment, short of execution and torture, the harshest penalty is solitary confinement. And we unfortunately have a lot of evidence of the fact that people who are held in solitary confinement for months on end go insane. So it is really important that we are in contact with other people. That will mean people within your household, but the fact that we're stuck together all the time has led to, unfortunately, a lot of family violence now, as well as alcohol abuse and the like. So we need to remind ourselves that we love our family members, and we need to tell them that. I have heard from many congregational rabbis, and I've seen it myself, that people dying almost never say, I wish I had spent more time at my job. They often say, by the way, men in particular here, they often say, I wish I had spent more time with my family. And it is really important to, even if your family is driving you crazy now because you're 24/7 with them, it is important to remember that you love them, and it's important to remember that you say that many times, because that will, first of all, be able to take the wind out of the sails of your anger at them for some particular thing. But it also is important to reach out to other people, in many cases, that you haven't talked to in a long time. I certainly have been doing that, and I must say it is really it's a wonderful thing to do on general grounds, right? But certainly now during this pandemic, don't reach out and touch someone, but do reach out to people, friends of yours that you haven't talked to in months, maybe years, whether it's by FaceTime or Zoom or the phone, that still works too, right? Just do that as a way of reconnecting, because we have very strong social needs. Let me just read you a short excerpt from an article that appeared in the May 25th Time magazine, reporting on a new study from researchers at San Diego State University and Florida State University. The study is full of grave findings. In April, more than 1 in 4 United States adults met the criteria that psychologists use to diagnose serious mental distress and illness. That represents roughly 700% increase from the data collected in 2018. Meanwhile, roughly 70% of Americans experienced moderate to severe mental distress, triple the rate seen in 2018. While this surge in mental distress showed up across age and demographic groups, young adults and those with children experienced the most pronounced spikes. The size of the increase shouldn't have come as a shock, says Jean Twenge, a co-author of the study and a professor of psychology at San Diego State University. In some ways, she says, this is a perfect storm for mental health issues. We're dealing with social isolation, anxiety around health, and economic problems all at the same time. And then I would add, of course, also the issues that have arisen because of the execution of George Floyd, Ahmaud Arbery, and the others. And as a result of the over now 16 days of protests and the like. And so that, of course, is then exacerbating the healthcare issue, right? We don't know whether 2 weeks from now we're going to have a major spike in the virus as a result of thousands, tens of thousands of people marching together for a very just cause, but often without masks and certainly without social distancing. If we don't have a spike in those cases, that will be a very good sign. But we may, and then the question becomes, how do we deal with yet another spike in the pandemic? But however that works out, it is really important for people to be in contact with other people. And I say this to men in particular. Women are much more adept at having relationships over the phone. Men are not accustomed to that nearly as much. But guys, you really need to learn how to do that, especially when we are isolated in our homes as much as we are. And then in terms of young people, taking care of children at home, where camps have now been, where they were going to spend the children were going to spend the summer are largely closed. So it's now camp parents these days, camp mommy and daddy, and mommy and daddy often have their own jobs at the same time. So how do you balance that? And how do you create programs for your kids that will be physically safe? There was a really interesting, in some ways funny, but very poignant article on the front page of the New York Times about a month ago, in which there was a family saying that, now I have to teach my 7-year-old how to read, but he doesn't want me to teach him how to read. So how do I motivate him to be at all interested in the academic things that he needs to accomplish? If nothing else, we are now finding out how much of a skill it is to teach. But now during the summer, we're also going to find out how much of a skill it is to run camp type activities. But it's I really feel for the parents with young children who are now going to have to fill in that role. The only thing I would say to you is, look online for a lot of suggestions. There are a lot of suggestions as to how to do that. For many of you, it's going to be a first time, or at least the first time in a long time after you were last a camp counselor, and you're not going to have the whole camp structure to help you do that. So let me just say that that's yet another challenge that this pandemic has raised. Okay, let me stop here and take some questions.
Hi, Rabbi Dorff. So there's a few questions that have come in, and I also want to say that if anyone has any questions, please write them into the question and answer, and we'll see them there. So one question from Rabbi Dobb is about valuing the cost and benefits of COVID and the certain time of quarantine. I'll read what he says here. You raise the trade-off of a working economy in tension with the spread of the virus. Apropos to Avram Reisner and Nina Beth Cardin's important tshuva on environmental responsibility, how do we also weigh the lower present mortality and morbidity from less air pollution, which disproportionately impacts people of color and poor people, and lower future suffering as a result of temporarily reduced carbon and methane emissions.
Right.
How do we build those in? Do they get built into the? Do they get considered in the calculations?
Yeah, I mean, there are several things here. First of all, let me just say that the tshuva that he's writing about And for that matter, all of the rabbinic rulings that I've been talking about are the ones that Rabbi Reisner and I wrote back in the early 1990 about end-of-life issues, the triage ones that Rabbi Nevins and I wrote just recently, and the rabbinic ruling that Rabbi Reisner and Rabbi Nina Beth Carden, they're married to each other, wrote about sustainability. All of those are available to everybody on the Rabbinical Assembly website. So just Google Rabbinical Assembly website, click the tab that says Jewish law, then click the tab that says Committee on Jewish Law and Standards, and then the rabbinic rulings there are organized by the 4 parts of the Shulchan Aruch, but you can just use the search engine and just look for end of life or triage or sustainability, and you'll find them. Yes, in order to be able to sustain people's lives, we have to live in an environment that does that. And we human beings have done very bad things to the environment, such that in many places the air is not healthy to breathe. In many places the water is not healthy to drink. And we have climate change, which is leading to, major issues in terms of rising water levels of the oceans and hurricanes and the like, right? Many more of them last year than before, much more serious storms than before, all of those kinds of things. And people cannot live under those circumstances. So one of the things that this pandemic has shown us is the importance of environmental concerns as well. Part of the reason why the African American community and the Latino community are suffering more from this disease than the white community is because they more commonly live near factories and live where both the air and the water are less healthy. And that is part of the prejudice that's built into our society, which affects delivery of healthcare as well as things like availability of healthy food. People in those areas are more likely to eat on the basis of fast food places because healthy food is not available in their neighborhoods. Yes, by all means, all of these things are really important pieces of being able to sustain life as well. No question about it. But those are, and they certainly affect both mental and physical health care. So thank you for raising that. It is part of the broader picture of what we as a society have to face. Absolutely. Next.
And so we also have a question from Rabbi Dreesen about I'll summarize that. What does Jewish law versus civil law, if there's a difference, say about going back to your conversation at the beginning about taking interventions and extreme interventions? What does Jewish law have to say about this?
Well, again, let me start from the beginning. Until very recently in human history, there were very few curative measures that people knew how to take. Preventive medicine was pretty good. So quarantine already exists in chapters 13 and 14 of the book of Leviticus. And in 1955, when I got measles, the Milwaukee County Health Department came and quarantined our house. So only my sister and I were stuck there for the month, and only my parents were able to come in and out. That's 1955, still using the preventive method for stopping communicable diseases that was used back in Leviticus 13 and 14, right? The rabbis already know that you should eat a lot of fruits and vegetables, not too much meat. They have a sense that you need to exercise, right? So preventive medicine was pretty good. Curative medicine was a whole other story. The only things that they knew how to do were to take a pint of blood because they had a sense that disease was carried by blood, and they were right about that. But the only disease for which taking a pint of blood works happens to be one that my mother had. It's called polycythemia, too many red blood corpuscles. And to this day, the way that is resolved is you take a pint of blood every once in a while. But it doesn't work for any other disease. The other thing that our ancestors were able to do was surgery. Some of you may remember the movie Dances with Wolves, which takes place during the Second World War. And in the early scenes of the movie, Kevin Costner, who plays the lead role, has a leg injury. He's taken to sick bay, and they showed what actually happened during the Six-Day War. They would get somebody who was wounded drunk. That was anesthesia. And then you get 4 people to hold them down, and then you saw it. And if the person didn't die of the surgery itself, the person would very often die of the infections that would come afterward. It was only around this time that a man by the name of Lister figured out that if people on the front lines would wash their hands between procedures, fewer people died. Hence Listerine, named after him, right? It was only when we got the sulfa drugs in the 1920s that we actually had a drug that could reverse serious medical conditions. Penicillin was discovered in 1928, but it wasn't until the early 1940s when President Roosevelt brought together the heads of biotech companies and said, you need to find a way to mass produce penicillin, because already in 1940, he was aware of the fact that we might be entering what became World War II. And it was then that the equivalent of Pfizer at the time created ways of mass producing penicillin. And penicillin is indeed a wonder drug in certain ways. I inherited from my father's side of the family a weakness in my bronchial tubes. My father had a brother who got bronchitis, it became pneumonia, and died of it in the 1920s in this country. I've had bronchitis about 15 times in my life, and I'm still here because of penicillin, right? The fact that well, just to give you a sense of this, in 1900, average life expectancy was about 45. In 2000, just 100 years later, average life expectancy in the United States was close to 76, right? More than 30 years of average life expectancy over a 100-year period. Most of that was public health measures. Things like you're taught to wash your hands before you eat and after you go to the bathroom. Things like indoor plumbing. I was at a conference in southern India, and you see these open sewage pits and flies all over the place, and you sort of wonder why people are not sicker than they are. But indoor plumbing is a major reason why we live much longer. Vaccines, of course, right? I had measles in 1955. The measles vaccine came on board in 1963. And so now most of my graduate students, let alone my undergraduate students, have never had measles because they were vaccinated for it. Chickenpox vaccine came in 1993, and fewer people are vaccinated for that. And so it's more common still. But vaccinations are another reason why we live much longer. And then public health measures, public health education, I mean. Things like, well, in California, people passed Proposition 65 about 10 years ago, which raised the tax on cigarettes to be used for ads primarily directed at teenagers against smoking, right? And then public measures like law. In California, you're not allowed to smoke within 50 feet of the opening to a public building. And you're also not allowed to smoke on Venice Beach. I mean, it's become very inconvenient and very expensive to smoke. So the smoking rate in the United States now is about 21%. The state with the highest smoking rate is, you probably wouldn't guess, but anyway, Kentucky. The state with the lowest smoking rate is, I'll give you a moment to guess. And let me just tell you that as soon as I tell you the name of the state, you'll understand why. Utah, okay? Because the Mormons don't allow it. 8% in Utah. The second lowest smoking rate is California, which has a much larger population and a much more diverse population, where the smoking rate is about 14%, a third less than the national average, right? Because of these public health measures. So, I mean, we live much longer now because of all of those kinds of things. But now we are faced with a pandemic that the likes of which we have not seen in a century, since the flu of the late 19-teens, 1920s. And so it's a whole new thing as to how we are trying to deal with those kinds of, with this kind of issue. Remind me what the question was. I want to make sure I answered it. Matt?
Sorry. Yeah, sorry. I also misstated the question, so I'll just read word for word what Rabbi Driesen wrote here. He was looking at the answer more. What if the person is prepared and signed a will indicating he or she doesn't want extreme measures, and what does Jewish law say about that?
Okay, so that's right. So there, you do have within the Jewish tradition, right? You're supposed to try to maintain your life, right? However, you are not required to subject yourself to a lot of pain. Quite the opposite. We as a community are supposed to try to diminish pain as much as possible. Now that leads to so some cases are pretty clear, right? Where somebody is, especially cases like bone cancer or pancreatic cancer, which very often involve a lot of pain, in many cases uncontrollable. So in those kinds of cases, those are precisely the kinds of cases that I'm talking about in my Aid in Dying tshuva that I'm still working on. But it's we have a duty to try to minimize pain, and we need to try to do that for people who are experiencing that pain. How far do we go with that? Well, that's a debate, again, between Rabbi Reisner and me. Back in 1990, morphine is titrated. So you'd use the least amount of morphine as you can in order to be able to quell a person's pain. It works by suppressing the respiratory system. So at some point, the next amount of morphine that you need may suffocate the person. So the question is, if you don't know whether the next amount of morphine is safe for the person or not, may you use it? He would say no. You may only use the amount of morphine that you know will not suffocate the person. I would say it depends upon your intention. If your intention is to quell the pain, then yes, you may use the next amount of morphine, even if you're not sure whether that will suffocate the person. On the other hand, if you know that it's going to suffocate the person, you clearly may not use that amount of morphine. Now that debate between us in 1990 is largely moot today because in the meantime, there's developed a whole specialty in pain treatment, and doctors are much more adept these days as understanding things like pain thresholds and body mass and how body mass affects this, and the degree to which your body metabolizes the pain medication. All of those kinds of things are much more part of physicians' knowledge now than they were then. But basically, you have a right to try to stop pain, and that means you do have a right to say, no, I really want palliative care. So both Rabbi Reisner and I would say that palliative care is permissible within the Jewish tradition. That's sometimes called hospice care. It's basically care to try to relieve pain. And by the way, you may remember a very famous non-Jew, namely Jackie Kennedy, who in the last weeks of her life decided to leave the hospital and to die at home. And that is perfectly that is perfectly fine from a Jewish perspective.
Okay, thank you. We have a couple of questions that are similar, so I'll combine them into one. But would Jewish ethics find hierarchy in making choices, such as between earning a living, protesting, and being a first responder for individual action when others are living in quarantine?
Well, I mean, I think the answer to that is that no, there's not a clear priority there, right? Um, we do need to try to save lives. We do need to provide the food, clothing, shelter, and environment that enables us to live. And we do need to fight injustice in our society, right? All of those are very important Jewish needs. You can't do them all. None of us is omnipotent. We're not God. So inevitably in our lives, not just now during the pandemic, but inevitably during our lives, we've got to pick our battles, and we've got to choose which of the various charities. Assuming you're not a mega donor, and even if you are, you've got to choose which charities you're going to support. You can't support them all, and many of them are very worthy. And so you've got to choose, Jewish education, your synagogue, your Jewish camp. What about the Red Cross? What about United Way? What about some hospital or some medical, something medical, or something environmental, or something dealing with poverty. All of those things are really important, and I have to say, my own life has been a balancing act in that. I went to Columbia as an undergraduate in the 1960s, and President Kennedy said, "Don't ask what the country can do for you, ask what you can do for the country." So on Thursday afternoons, I was in a junior high school in Harlem, teaching 7th graders who were reading on a 2nd grade reading level, right? In my last year of college, I was at a different junior high school in Harlem, teaching 9th graders who, if anybody was going to go to college, these were the kids. So I was doing enrichment work with them. And this has been the kind of thing that's going on right now in terms of trying to raise the educational level and also obviously the economic level of the African American community, the Latino community. That's been part of my life from at least my college years, if not earlier, right? I'm a past president of Jewish Family Service in Los Angeles. We run, it's about a $28 million budget each year. We run 50 or 60 different kinds of programs from mental health issues, drug and alcohol abuse. We run the SOVA food pantries, right, for people. And along with the food pantry, along with food comes a social worker who helps people who are homeless find other resources and begin to get the skills to learn a job, right? All of these things. And then I do a lot of bioethics. So, I mean, all of these things have been part of my life. Some of them much more part of my life at different stages of my life than others, right? But I think that's a kind of balancing act that each of us has to do. And none of us is going to be able to do everything. But my very favorite, without question, favorite, bar none, saying of the rabbis is Rabbi Tarfon in Pirkei Avot. Lo alecha hamlacha ligmor, ve'enata ben chorin libatel mimenu. Yours is not to finish the task, but neither are you free to desist from it, right? I think it's a menu for both responsibility and sanity. Yours is not to finish the task. Don't think that you have to do everything, because you'll just drive yourself insane and end up doing nothing. Yours is not to finish the task, but you are not free to desist from it. You do have a responsibility to do what you can. And what you can, where you are, given your situation, medical situation, financial situation, marital situation, all of that, right? What you can do will vary from one person to another and from one stage in your life to another. But you need to be able to pick your causes and then run with them.
Okay, thank you. There's a couple of questions here again about sort of ventilators and how you reprioritize treating people. One of them is specifically about Jewish law as far as whether or not there's a preference for Torah scholars, and the other one focuses on when things are done by lottery, is there a place for human judgment and compassion in that triage process?
Well, let me do the second one first. Clearly, human compassion and human judgment are central to the Jewish tradition. I mean, love your neighbor as yourself. The Christians got it from us, right? Leviticus 19, right? A very strong sense of the need to help the poor. Rambam Maimonides says he doesn't know of a single Jewish community that did not have a soup kitchen and a charity fund, right? I think we Jews, grow up really almost from our mother's milk with a sense of responsibility. And, sorry, and even Jews who are not very observant in terms of ritual practices, are very often very much involved in and proud of Tikkun Olam as central to the Jewish tradition. So yes, of course, both compassion and judgment are central to our tradition. The problem, and by and large, that's exactly what's at play when we are delivering healthcare. The problem with triage situations is that by definition, you don't have enough, either personnel or materials to treat everybody. And that's the reason why you need to try to do it as justly as possible. And that's what then leads to the triage decision, that the triage rulings that I wrote, that Rabbi Nevins wrote, and that others are grappling with. And the only way to do that, again, if you have 5 people, all of whom need the one ventilator, is, it seems to me, assuming that all of them are more or less in the same medical condition, the only way to do that fairly, it seems to me, is by lottery. And then you mourn, and I mean that, and then you mourn your inability to treat the other 4. That's the tragedy of triage. Now, in terms of Torah scholars, there is one Mishnah in Horayot that says somebody, in terms of saving life, somebody who, it's put very starkly, a mamzer, an illegitimate child who knows a lot of Torah, takes precedence over a Kohen Gadol. But I have to tell you that already that's a very problematic Mishnah in all kinds of ways. And already by the time you get to the Shulchan Aruch, the Kara already says, we don't use that Mishnah to decide who gets what when resources are scarce. So the answer to that is no. It really is, the triage decisions have to be made without reference to the worth within society, however you judge that, the worth within society of the people who need the machines or the medications.
Okay, we have this will be the final question here from Rabbi Fuller. We know now that the overuse of antibiotics is creating dangerous situations such as superbugs. Is there a Jewish point of view on what we should do about this vis-a-vis pikuach nefesh?
Yes, absolutely. And he's absolutely right. We have overused antibiotics, by the way, especially in animals. And what happens is then that that those antibiotics then get passed through the food chain. So those who eat meat then ultimately develop the inability to have those antibiotics help them when they are themselves sick and need them. And add insult to injury, it's not just the people who eat the meat who have the antibiotics in them that then develop a kind of develop an inability to have them be effective, but all the rest of us as well, because the bug then becomes a super bug, as he pointed out, and so then antibiotics that used to be effective in fighting certain diseases no longer are effective, and that can then lead to other kinds of pandemics. So what do we do about this? First of all, we have to stop very clearly and immediately stop the use of antibiotics in the raising of animals. Excuse me. And then we also have to, we as human beings, have to be very clear with our doctors, very, very respectful of our doctors. When our doctors say to us, what you have is a virus, not a bacterium, and therefore the antibiotic will not work on your illness. Don't pressure your doctors for antibiotics when it's clear that they're not going to work. And instead follow the directions of your doctors to fight the virus that you have, if that's what you have, whether it be COVID-19 or some other virus. So we need to do both of those things. We need, on a public health level, to stop the use of antibiotics in animals, and we need to stop the overusage of antibiotics in human beings. Okay.
Thank you, Rabbi Dorff. This has been a very insightful lecture. We don't have any more time for questions today, but we appreciate you sharing your knowledge with us and thoughts. And I also want to thank all of you out there for joining us, and we look forward to seeing you all at future upcoming programs.
Remember, reach out and talk to people.
Yes, socialize.
Okay.
Thank you.
My pleasure. Take care.
You too.